Good afternoon, everybody. On behalf of Sanctum Care Group, as well as our Executive Director, Caitlin Roberts, and myself, Kathy Malibu, Program Director, we would first of all like to thank Kimberly Lane and Lisa Lockey for the opportunity to speak to everybody today on Sanctum 1.5, an alternative approach to HIV and high-risk maternal care. Before we get started, we would like to acknowledge that we live and work on the traditional territory of the people of Treaty 6. Our learning objectives in this presentation are going to be a few things. First of all, we'd like to familiarize everybody with the mission, rationale, goals, and criteria of Sanctum 1.5, to discuss our referral process to the program, discuss the alternative care approach that we have used thus far, discuss our challenges, as well as discuss the outcomes of the program as Sanctum 1.5 approaches the end of our first year, which is coming up on October 1st. I'm going to turn it over to Caitlin, and we're going to just switch off back and forth, so you'll hear two voices, which is probably better than just mine. Here's Caitlin.
Hi, everyone. So just a little background on the organization itself. We are a group of interagency professionals that came together in 2013 to start the non-for-profit Sanctum Care Group. Our aim at that time was to open up Saskatchewan's first HIV hospice and transitional care home. We were able to do that in 2015, and subsequently we have also opened up the Beehive, which is a transitional apartment building for people living with HIV, HEART, which is our HIV/AIDS response team, and then most recently Sanctum 1.5. We're very lucky as an organization to have a very qualified board of directors who are all very passionate about providing healthcare to marginalized populations. And so this is our board, Dr. Maurice Markington, who is a physician at Westside Community Clinic, also a methadone prescribing physician, and he was the co-founder of Sanctum Care Group along with myself. He rounds at Sanctum daily and is certainly an asset to what we do. Chris Mason is our vice chair, who is a lawyer with the College of Physicians and Surgeons. Dr. Alexandra King, who is the chemical chair for the university, Dr. Peter Butt, whose expertise is in mental health and addictions, Dr. Lexi Regish, who is an obstetrician and gynecologist, Steph Klopchuk is the VP of Tourism, Sandra Blevins is a VP with nursing, Jean Morrison is the CEO of St. Paul's Hospital, and our treasurer is Brad Packlin with KPMG. So our mission at Sanctum is to provide care to people living with HIV/AIDS that is dignified, non-judgmental, and unconditional. And our vision really is for a community in which individuals requiring this assistance are able to attain their optimum level of health from their perspective, minimizing their vulnerability and maximizing their control and dignity. And this vision really comes from a frame of harm reduction, and at times can be difficult because what we want for our patients isn't always what our patients want for themselves, but we respect our patients and their autonomy in making decisions. And of course, we recognize the need to provide care with humility and without prejudice.
Our mission and vision is achieved, as Caitlin said, through a philosophy of harm reduction and person-centered care, and that is something that we really pride ourselves on. Every individual that comes into Sanctum and Sanctum 1.5 is able to sit down, and we plan a care plan that is strictly suited to them, and we focus on what their goals are, and it is our mission then to help them achieve the goals that they have identified that are necessary for them to achieve a level of satisfaction in their lives. We also bring with us core values of compassion, collaboration, and innovation, collaboration. As you will see, we collaborate with many other non-for-profit organizations, as well as partnering with the Health Authority, with Westside Community Clinic, to name just a few. And innovation, as you will see, is what puts us probably apart from other organizations that work with the population that we do. Sanctum 1.5. What we're going to do now is show a quick video, which is our promotion video of Sanctum 1.5. And this will give you a really good idea of what we do here.
Women need a chance. Women, they want to change. They just need people to believe that they are going to change and not judge them based on their bad decisions. When I first tried crack, I was 12 years old. Started shooting up when I was 13, working the streets at the same time. I remember when me and my mom used to work like right across the street from each other, like kitty corner. It was like horrible. It's not like I woke up one morning and said, oh, I want to be an addict. I want to be strung out on East Hastings Street, you know? My lifestyle led me to that. I didn't plan to be pregnant. I wasn't going to keep her. Just the lifestyle I was living and having a kid and having it taken away. Couldn't go through that again.
The women that we take into our program are women we will have their children apprehended. Oftentimes, women who are struggling, who are pregnant, don't leave services until after the baby's born. And so that's really counterproductive to keeping moms and babies together. And it's also counterproductive to having healthy pregnancies and health outcomes for both mom and baby.
When I first found out that I was pregnant, I actually was living in the hood. It was so bad, people didn't even take off their shoes because there were dirty needles, there was cockroaches and mice. I told my one buddy who was a gang member that I was pregnant, and I told him that I was going to keep my baby, and he looked at me and he said, that is the stupidest thing you could ever do. You'll be sitting in the hospital room holding your baby, and they will come and take her right from you. You'll see her for 5 minutes and you'll never see her again. I really felt kind of hopeless, just thinking like there's nothing I can do at this point. When I was asked about the program, Susie had walked in. She pretty much told me there's little chance of you leaving the hospital with your daughter. She's like, I don't know if you're planning to keep her. And I thought, well, if that's an option, then of course I want to be her mom. I want to be there for her. She said, what if I could tell you that you would leave with your daughter from the hospital, but you could come and stay at Sanctum? I thought, yeah, I want to be a part of this.
The strength and the resiliency of the women that we've had the privilege to work with is unprecedented. They want so deeply to be a mother and a good mother. We don't look at them and say, what do you know, what do you don't know? We direct them in a more rounded approach. Some moms may need help mixing formula. Some of them may have never mixed formula before. It's the basics. This is how you wash a baby. This is how you diaper a baby. We show them baby being weighed. We show them that, hey, baby's growing. You're doing such a good job.
If Legacy had got taken away from the hospital, my recovery would not exist right now. I would be numbing the pain of not being with her. Sanctum has helped me realize that I can, and I do deserve to be a mother. When Kathy told me that, it made me cry, because I've never had anybody tell me that before, that I deserve to parent Legacy and that I deserve to be her mother.
For many of them, this is the first time they've been given the opportunity to demonstrate that they can parent. So it's a fresh start for mom, but it's also a fresh start for baby. Not only through the perinatal stage are we increasing health outcomes for baby in terms of having a healthy pregnancy and for mom, but more importantly, that baby is going to bond with its mother. And that attachment is so critical to the development of that baby moving forward.
The need in Saskatoon for an organization like Sanctum 1.5 is enormous. I can't even find the words. I mean, Caitlin has provided a structure and a model that doesn't exist elsewhere, but meets the community right where they need the help. Being able to anticipate and respond to those needs in such an individualized way, and in a community of women that can be very difficult to engage, is a monstrous task, and they've done it beautifully.
When I look at the women that have come into our program and have graduated into the community with their children, I think about how different it would look if we weren't here, and that scares me because those women have demonstrated in a very short period of time that not only are they capable, they are amazing parents and they love their children.
They made it easier for me by just being there for support and emotional support whenever I needed them to talk. They were there, they understood, they didn't judge me. They made me feel accepted and normal, like I'm not someone who should be shunned and put in the corner and that I'm a horrible person for what I do. They made me feel like I was human.
Sanctum pretty much cared about me until I was strong enough to care about myself. And now I have a home. I even have the hopes that I'll get my son back in my life. There's actually potential for things to get better. I owe everything to them.
Okay, so Sanctum 1.5, the goals of this program are really twofold: to prevent vertical transmission of HIV and to improve health and social outcomes for vulnerable women and their children, but also prevent children from entering the foster care system through a preventative approach by providing a nurturing environment for both mom and baby that allows for bonding and prevention of attachment disorder. So before Sanctum 1.5 opened, what we were seeing in the community was women who were either HIV positive and pregnant and not engaged in the healthcare system, or also women who were at risk of contracting HIV while pregnant, really in a state of chaos. And while there were some supports available to them, primarily it was crisis management, and we really weren't making any progress in terms of moving moms along to a place where they could actually parent their children. Social services really doesn't work with these mothers until baby's born. That is their mandate, is children, and so the support often comes into place after baby has been born. And so what we were seeing was a lot of women who would come into hospital, deliver baby, and then shortly thereafter have baby apprehended. Certainly the trauma that this population has experienced and the history that the vast majority of our moms have, the hospital can be a very triggering and traumatizing place for them to go, given that most of the moms that we work with have had their babies apprehended from birth at hospital. Also, providing the support postnatally once baby's been born, like we talked about in the video, is really counterproductive to keeping moms and babies together. So essentially, what we proposed was a preventative approach where we would take moms at any stage during their pregnancy and start providing, most importantly, I would say, their basic needs with housing, nutrition, and safety, and building in individualized supports and services that would mitigate the risk associated with children being apprehended at birth. And a big piece of what we do is trauma-informed care and reducing the trauma of going into hospital and having those triggering experiences. So our staff really support moms, from the moment they walk in our doors, wherever they are in their pregnancy, through labor and delivery, and then post, they come back with their infants and continue to parent within our program. One of the driving factors of Sanctum 1.5 also was the increase in vertical transmission that we were seeing. And specifically in Saskatoon, a significant amount of either HIV positive pregnant women or women at risk of contracting HIV while pregnant. So Sanctum 1.5 is a prenatal home for moms living with HIV or at high risk. And just to clarify, because there seems to be a bit of a misunderstanding around that in the community, is that we take both HIV positive and women who are at risk of contracting HIV, because we know that if a woman is not positive and contracts HIV while they're pregnant, the risk of vertical transmission goes up substantially. Essentially providing a safe environment for both mom and the unborn baby. And the other thing that people often think about Sanctum 1.5 is that we only accept moms who want to parent their children. We accept mothers regardless of where they're at and what their goals are. If we do nothing else other than improve the health outcomes for both mom and baby while pregnant, then that's a huge success. So lots of our moms who come through our program aren't always sure about whether or not they will parent. And also, as an agency working closely with the Ministry of Social Services, some of our moms we know coming in will not be able to parent their children, even though we put in all the supports and services in place.
We also make sure at every point in time we are reiterating to moms that even though they may have a plan in their minds, that those plans can change at a moment's notice. We've had 2 moms thus far that have come in and had made up their minds to put their children up for adoption. And to date, we've had one of those moms transition out of the program with her baby, and the second mom is currently here at Sanctum 1.5. Head over heels in love with her child and doing a knockout job of being a mom.
The other piece I'll add in terms of prevention, and this is in terms of planning for baby, is that the way the system works, if you have a baby who's apprehended from birth, certainly the Ministry of Social Services does everything they can to locate family once baby's been born, if mom is unable to parent. What we do at Sanctum is we start that kinship search as soon as mom comes into our program. Even if parenting is their goal, we go through this process with all of our moms, and our moms are very agreeable to it, right? It's about having that safety net and that plan for baby should something not work out. So we avoid foster care altogether, because typically, while a kinship search is being facilitated by the ministry, or if there is no family available, babies will linger in foster care for up to 18 months before the ministry has to have a permanent plan for baby. And so that's really where Sanctum feels we do a lot of really good work in terms of preventing attachment disorder. So the referral criteria for Sanctum is that women must be pregnant. They must either be HIV positive or at risk of contracting HIV while pregnant. So typically that looks like injection drug use. And these women are at risk of having their children apprehended at birth. Obviously, they must be a resident of Saskatchewan. And essentially, we do take referrals from anywhere in the community. It does not have to be from a hospital or a doctor's clinic. We have a fairly simple referral form that needs to be filled out with mom for consent, but it is not a complicated process, and we certainly do not expect referrals to come directly from physicians, although a lot of our referrals do. We are open to anyone in the community referring a mom who meets this criteria.
So what is it that we offer at Sanctum 1.5? Medical support, we have program director myself, who is also a registered nurse and has worked with HIV population for many years. We have a nurse practitioner from Westside Community Clinic, Della Magnuson, who rounds weekly and as necessary throughout the week, and also on weekends, evenings, you name it. We have the physicians that we have, family physicians specialize in addiction medicine and round as needed as well. So if we're having issues with moms with methadone withdrawal, anything like that, we can call on those physicians and get an immediate response. We have a pediatrician, Dr. Molly Brindamore, who rounds with us weekly, sometimes more often, depending on how babies are doing. And she also guides us with our Eat, Sleep, Console, which is a non-pharmacological approach to managing neonatal abstinence syndrome for our infants. Dr. Brindamore has been absolutely phenomenal adjunct with us, and the knowledge that she brings with her has been incredibly beneficial to all. So what we do is we provide a wraparound integrated support and care for our moms, individualized case planning, which begins with our care and housing or our care coordinator instantly. We case plan with these moms. Actually, it's Megan who case plans along with the ministry as well. We make sure that all of the supports that mom has identified are involved to the level that they need to be, and as well as if they are struggling with having or accessing supports, we make sure that everybody has sufficient support. Harm reduction, patient-centered approach, trauma-informed, meeting people, our moms exactly where they are at. Our dialogues are very open, they're very heartfelt. We are constantly challenging, walking with them around the substance misuse, relapse, and recovery. We have several policies that we put into place to help guide the occurrences when we do have somebody who has had a split.
And I'll just add to that too that it is not in our criteria that mums be abstinence from drugs or alcohol to enter into our program because we are a harm reduction agency. So we do, I would say all of the moms that come into our program are struggling with active substance misuse. And so one of the key ingredients to kind of seeing some good success with our moms is getting those referrals on our prenatal moms as early as possible to give both mom and our agency and the multiple agencies that work with the moms while they're here the time and space needed to kind of work on that recovery. Because obviously once baby is born, while we still are a harm reduction agency, our moms understand that in order to parent, one must be sober. And so that is where our weekly talk screens come in, and sometimes instant talk screens. We do have, some really, I would say, in-depth policies around substance misuse in our agency and managing that with our moms within that trauma and violence-informed approach to care. What we do not do at our agency is shame and blame, but we do address substance misuse and relapse. There is no use allowed in our home, and so as an example, if we have a mother who has had her baby and she is found to have used, what our policy is that she goes to detox. Once she's completed detox, she is able to come back to our home and parent baby under the supervision of staff until she has provided a clean talk screen. And that's, I would say, a really key factor in our moms doing as well as they do, is having that bond with baby and using that bond as a motivator for continued growth and change. Certainly, we've worked with moms who previously in the past have been, unsuccessful in their sobriety. And we believe, due to the fact that baby was in foster care while they were attempting to enter into sobriety, and they had not established a bond with that baby, because we have certainly seen that bond play as a primary motivator for our moms to enter into that path of recovery. So some of the outcomes that we've seen with Sanctum 1.5. So we opened just about a year ago, and as of September 1st, we have had 21 moms admitted into our program. 19 babies have been born to these moms, all healthy with no involvement in the foster care system. So I should add, and I think we're missing a slide on kind of what our outcomes that we wanted to achieve with this program was the reduction of vertical transmission or transmission of HIV to the fetus, and preventing children from entering the foster care system and improving the health outcomes of both mom and baby while in our program. So yeah, 19 babies, all healthy with no involvement from the foster care system, no vertical transmission. We've had 12 moms transition out of our program. 4 are living independently in the community, parenting their children, some of which are now having their other children who have been in care return to them. And then we have 5 moms who are in supportive living with their babies. So we are lucky in Saskatoon that there are other programs that offer support to moms once a baby is born. And so we have transitioned some of our moms there where they'll continue to have support as well as our support. We follow our moms when they transition out of our program for a year post. And then we had 3 moms who placed their babies with family. So as of September 1, 2019, Sanctum is 100% in terms of our outcomes, which, and we'll get to the challenges slide, is it's great, but certainly this is not for the faint of heart. Our population can be really difficult to deal with, but certainly very rewarding work that we do.
I'd just like to touch on the Eat, Sleep, Console method of care that we use to manage neonatal abstinence syndrome in hospital traditionally, and what continues right now is that neonatal abstinence is scored on a Finnegan scale, which it's a series of observations that are used, which can be actually very subjective. And it doesn't conform to what is now touted as the current best practice for managing neonatal abstinence, nor does it foster a bonding and attachment with mom. And it is costly. Currently at RUH, when babies are going through or being managed for neonatal abstinence, they spend time in NICU, the NICU. In that unit, it is very stimulating, it is very loud, and there are so much hustle bustle, and moms really at times are kind of not able to be with their babies as much as they need to be in order to bond, but most importantly to provide skin-to-skin contact with that child. So what we have adopted is Eat, Sleep, Console. And as we had said before, it is a non-pharmacological approach to care that we experiences 80% efficacy when compared to using morphine to manage withdrawal symptoms. And it is effective and it is very efficient. Probably a quicker wean for babies in the long run than having them being admitted with or having them on prescribed morphine and weaning them down. What it does is it promotes healthy bonding and attachment using skin-to-skin contact with mom. And that is really one of the hallmarks of the Eat, Sleep, Console. We look at the baby and we score them simply on what is their ability to eat and collect themselves to eat properly. How consolable are they when they do start crying, and how well are they sleeping? Those assessments are performed every 4 hours by the care provider, as well as consulting with mom, because mom is with babies all the time. And if they are doing well, they will have a score of 1. And every 4 hours we are looking at those scores. If for some reason baby scores higher than the 1, twice in a row, or if the baby is not responsive to the consoling techniques, which are very basic and very succinct to follow. There's a call made to myself, and I contact Dr. Molly Brindamore, and then she comes in and we consult and we meet, and we care for baby going forward. There has been once in the time that we've used eSleep Console where we had to resort to using morphine for a minimum of 5 days just to get baby over the hump. Baby was on and off very rapidly and on a very minimum dose.
So we just thought we would briefly touch on some of the challenges we've had with Sanctum 1.5, and certainly in Saskatoon and across Saskatchewan, the high rates of crystal meth have really impacted the population that we work with. A lot of I would say probably, and I can't say for certain, but I would say probably 80% of the moms who come into Sanctum are dealing with addiction to crystal meth. And currently there's really a lack of appropriate addiction support in the community to manage what we are now calling our crystal meth epidemic. We are getting moms who are referred late in pregnancy, and that really decreases the opportunity for successful transition from actively using into sobriety, so that we can support recovery and mom and baby staying together. The women that we deal with have all been through the foster care system. The vast majority of them all have children in care. And so there is a high incidence of severe history of trauma. And, again, a challenge for us is the lack of trauma counselors available to our population. We are lucky in that we do have a trauma counselor who comes in weekly now. But certainly there's never enough support when it comes to the devastating impacts of severe trauma. And for this population, the chronicity of that trauma really impairs their ability to recover and move forward and enter into kind of healthy coping. With Sanctum 1.5 being the first of its kind in Canada, certainly there's been a lot of misconceptions and misunderstandings of what we do and how we administer our programming in the community, and a lot of uncertainty because this is a new approach, especially for the Ministry of Social Services. This is a prevention strategy towards reducing apprehensions, and one they've never kind of encountered before. But I will say that the partnership that we have established with the Ministry of Social Services has been incredibly beneficial and rewarding, and I think that goes both ways. And then lastly would be the lack of awareness of our program. We still see babies in hospital being apprehended, but also with that, now that we've are a year in, we certainly are also dealing with the reality that we are full. We have a wait list, and even though we are open, we will not be able to prevent every baby from being apprehended from our hospitals.
One other thing I would just like to put out there for the challenges for our moms, when they do walk into sobriety, it is one of the most frightening and lonely moments of their lives, because they're being asked to leave behind a life that they once had, as well as potentially family, friends, and letting go and starting over by themselves. And it's very frightening. It's very scary, and oftentimes that struggle is what we work with intensively as they work with us here at Sanctum.
And our response to that, we have piloted a project here called Mentor a Family, and so we selected 3 of our mothers who we knew all of their supports in the community were very unhealthy, and they had to kind of separate. And so we worked with another non-for-profit as well as the Westside Community Clinic in training 9 different families to work with 3 of our mothers. And really the role of those mentor families, so every mom has 3 mentor families attached to them, and their role is really relational support. The relational support that agencies really can't provide because we are a service provider and our residents are aware of that, but kind of essentially creating a sense of family and belonging for these mothers with a healthy network of people, but also, again, aligning with our mission to reduce trauma and our understanding that with recovery also comes relapse. And so knowing, or these moms having the support available should they relapse, that their children can go be with uncle and auntie until mom is able to parent again, so that we're not sending children into the foster care system, but and in doing so reducing the trauma associated with having to go into a stranger's home. And so now we'll just enter into the question portion of the presentation if anyone has any. So somebody just asked how many beds there are. We have capacity for 10 moms and 10 babies.
While we wait for the second question, each of our rooms has a bed for mom, a bassinet or a crib for baby, as well as their own private sink and lockable storage. The bathrooms are shared, and really, there has been not much issue around that.
Yes, so we are also located, the question is if moms go to detox or treatment, do their babies remain at Sanctum? They do, and we are very lucky. We're located across the street from detox, which is really beneficial for us when moms do relapse, that we have that support available across the street. I will say one of our struggles is that detox is often full. So that presents as a challenge for us sometimes with our moms, because we have a policy where they need to go to detox, but detox also can't always accommodate it. We also, if they do go to treatment, we've had a few moms go to family treatment, so they're able to take their child with them. But for the moms that don't, we try and facilitate daily visits with babies to continue to encourage that bond. Right now there is a wait list. We have 4 moms on the wait list, but that doesn't mean that those 4 moms will necessarily be a fit for our program. But right now we are full with 4 moms who have been referred. And part of our referral process or our admission process is to meet with every mom individually and also connect with the organizations and supports that they may or may not already be working with in the community to establish whether or not the mom is a fit for the program.
Our referrals are also not necessarily on a first come, first served basis. We do triage to who has the highest need or the most pressing need at that moment. And oftentimes it is simply defined by who is due first.
The other question was, can other children that the mom has live at the house too? Because of the criteria that we have for our program, the mothers that we are working with would not at this time have custody of their children. Because we are dealing with moms who have active substance use, their children are in care. And yes, we do take referrals from rural areas.
We are open to every resident in Saskatchewan. The referral form can be accessed through Sanctum 1.5 by notifying Caitlin Roberts. Her number was on the screen previously, myself, or simply calling Sanctum 1.5, and we'll be sure to get a referral out.
In terms of whether or not there's a time limit for mom and baby in Sanctum, so moms can come at any stage during their pregnancy. Once they've had baby, we try and stick to about a 3-month period, so they're here for 3 months post with their baby. And then one of the kind of critical things that we do when a mom comes into our program is we connect them to all sorts of different supports and agencies in the community. As well, we follow them post a year. So our social worker and our cultural support worker work with those moms in the community for a year moving forward. So while they're not a resident of our facility after typically around 3 months, we still work with them for a year. That being said, nothing we do is black and white. So we have had moms who have been here with their infants for 6 months.
One really impressive and encouraging sign that we've noticed so far is that most moms will return to us for right now. They pretty much all book themselves in for Sunday evening dinner. They love the food, they love the company, and it's absolutely wonderful to have them back.
Do we follow women even if they're moving back into a rural or northern community? Unfortunately, no, we do not have capacity for that. But we work with our partners, whether it be the Ministry of Social Services or other agencies that have a further reach than we do to support those moms should they not be remaining in Saskatoon. And it looks like that's probably it for questions. So I just want to thank you all for listening to our presentation this afternoon and hope you all have a great day.
Thanks, everyone.